So whenever in question paper, it's given that the patient is having an unintentional weight loss for more than 10%, diarrhea for more than a month, okay, it means the immunity is gone for a toss. It could be Human Immunodeficiency Virus, right? All these things are to tell you that these might be the signs that you can see in the patient with HIV/AIDS. Okay. This is how the HIV virus looks. Human Immunodeficiency Virus belongs to the family Retroviridae, genus Lentivirus. Okay. Virus is spherical in structure. It is made up of lipoproteins. What is this? It's an enveloped virus. The envelope is made up of lipoproteins. Okay. What is this blue thing? You can see the blue line here. What is this? This is nucleocapsid. Okay. Inside it, there are two identical RNAs. Okay. What are these? Along the envelopes. No, these are glycoproteins 120 and 41. This mushroom-like structure is GP120. This attached to this is GP41. What does this thing do? Attaches to the CD4 surface, and this does the fusion. Okay. Then, most important characteristic, presence of reverse transcriptase enzyme. Okay. Easy to tell. How many genes are there? There are 3 structural genes present: GAC, POL and ENV. And then there are non-structural genes. 3 of them are necessary, 3 are them of accessory. But looking at the structural genes, the GAC genes are responsible for what? P24, P17 and P7. Out of this, P24 is useful in detection in the window period. Okay. Then polymerase gene is responsible for enzymes. Which are the 3 enzymes? Reverse RT, integrase and protease. These are the enzymes on which antiretroviral drugs also act. Okay, if you give the medication. Then the structural envelope gene, that are GP120 and GP41, we discussed. GP120 is responsible for attachment and GP41 is for fusion. Okay. How does the HIV get transmitted? Blood transfusion, sexual intercourse, and mother to child, and subcutaneous injury. Okay. So out of these, what is the difference between route of transmission and percentage of transmission? Like, which one is common and which one is least common? Here you can see that percentage of transmission is very less, 5%. But over here the risk of transmission is more than 90%. What does this mean? It means if a person is getting a blood transfusion from an HIV positive person, he will 90% there is a chance, there is a risk of transmitting virus. It means he'll definitely get the infection. But this percentage is very less, like it rarely happens. Okay. Likewise, if you see in needle stick exposure, if a person is getting a needle stick injury, there is 0.3% chance of transmission. Okay, less than 1%. In 100 people getting infected, getting injury, less than 1% can get infected because of this infection. But how much is the percentage of total transmission? In India, it's 1%. Okay. Did you understand this concept? Now, when you diagnose HIV, first we'll discuss the symptoms. What happens when a person gets infected with HIV? Is it an acute syndrome? Is very long. Why do we say that the incubation period is very long? Because you see here, what is this? This is HIV virus, right? It is spherical, enveloped, showing GP120, GP41 and the 2 RNA strands. And what is this? This is your T lymphocyte. Okay. What can you see here? Surface antigen. Okay. Along with the surface antigen, which helps in the attachment of HIV virus on the cell surface through GP120 and GP41. GP41 will also help with co-attachment to CXCR4, which is commonly present on T lymphocytes, and CCR5, which is commonly present on macrophages. Okay. These help in the attachment and fusion and facilitate the entry of double strands into T lymphocyte. Okay. The whole cell will not get inside, only the strands. But these are RNA strands, right? These are RNA, and human cell has DNA. So what will happen? Reverse transcription will take place and this will be converted into DNA. This DNA will be incorporated in human DNA, and that's how the RNA genome, there are steps of viral replication that you have to study. Then all those steps take place, the maturation will happen and it keeps on replicating inside the cell, and ultimately cell will undergo lysis, which is why CD4 count is less in CD4 T-cell count is less in HIV infected person. Understood? This you understood? What were we discussing? We were discussing pathogenesis. When after this happens, so when a person is infected with HIV virus, after getting into, what are the ways HIV virus gets into the blood system? We just discussed. So all those ways, when it gets into the system, first thing will occur, what is that? Acute HIV syndrome, which will be a flu-like illness, febrile illness, but it will not last long because your immune system comes in action. So what will happen after that? You undergo a latency phase. But it is what? It is not a microbiological latency. What is happening inside the body? The virus is still replicating inside your T cells, right? But there are no symptoms yet. Then what will happen? You will notice a generalized lymphadenopathy, which is the third stage. First stage was acute. Okay. Second, loudly, latency phase. Third, Generalized lymphadenopathy. Then fourth will be symptomatic stage. What are the symptoms you saw in the case earlier? Weight loss, diarrhea for more than a month. Okay. So that is known as AIDS related complex. Okay. And when CD4 cells are less and persons start getting secondary infections, that is ultimately AIDS. Okay. So what do you think your case is in? Which stage? Fourth stage. Okay. So how will you diagnose if somebody is symptomatic? So according to NICO strategy in India, we do 2 or 3 steps to determine microbiologically through these tests, through diagnostics. Why one test is not used? Because it's not possible for us to run confirmatory tests like DNAs and to count the CD4 count cells in low income countries like India. So we are using this strategy. Okay. What are we doing here? If the patient is asymptomatic, we will use 3 test strategy. If the patient is symptomatic, we will use 2 or 3 tests. But if the patient is asymptomatic or patient is undergoing any surgery or in case of pregnancy, we will use this strategy. Okay, what can you see here? These are 3 tests. So what does NICO say? The first test should be sensitive and the other 2 should be specific. Okay, first is high sensitivity, second and third is high specificity. What are you seeing here? If this first test is negative, reported negative, and the patient is asymptomatic, what does it mean? It's negative. Okay, but this test comes positive, you have to go for the second test. If both of them come positive, then you go for the third one. If 3 of the tests are positive, then it is positive. Okay, confirmed HIV. Then if either of these 2 are positive, one is negative, it's indeterminate. Then again here the same picture is happening. This test is negative, A2 is negative but A3 is positive, again it's indeterminate. And here, in case if these 2 tests are negative, you will have to consider the risk. Okay, higher the risk. Which are the higher risk group? Higher risk groups are those which are which are sex workers, okay, transgenders, or people with IV drug abusers. These are higher risk groups. And lower risk groups are healthcare workers, anybody is got pregnant with the HIV positive patient, all those. There are 2 serotypes. You might have heard about HIV-1 and HIV-2. Out of this, HIV-1 has subgroups M, N and O, which are again, M is again classified into subtypes, and both of them are classified into subtypes. In HIV-1, subtype C is most common in the world and in India. Okay. Let's revise this. What does it look like? Spherical. And this nucleocapsid is icosahedral. Icosahedral means having 20 flat surfaces. Okay. Then what is this? This is envelope made up of lipoproteins. What is this? GP120. This 41. These are 2 viral RNA strands. This is reverse transcriptase, just to see. Okay. Then what are the structural genes? GAG, POL and ENV. Classification into serotypes 1 and 2 depend on ENV. Okay. Then which of these are responsible for the enzymes for replication and maturation, pole, and GAG is responsible for early diagnosis, P24. Okay, GP120 is for attachment, GP41 is for fusion. Most common risk of transmission in blood transfusion. Okay, what do you understand by needle stick exposure? What do you mean by that? If any of the healthcare workers get pricked by any of the used instrument or sharps. Okay, so what should we do? First thing, you should wash it with the running water and soap without applying any antiseptic or disinfectant. Okay. Secondly, what should you do? You should go to the nodal officer and inform the infection control nurse or infection control officer that you have been pricked by a needle or instrument. Then, if the patient is unknown or patient is known case of HIV, then what should you do? You should take first dose of ART within 2 hours. Okay, within 2 hours or not less than 72 hours. Okay, that's the first. Also, along with this, as a healthcare worker, what should you do? You should get vaccinated for hepatitis B. Okay, how many doses? 3 doses at 0, 1 and 6 month interval. Okay. This was the strategy for which individuals? Asymptomatic. In case of symptomatic with clinical picture, in your given case, what will you do? You can go for even 2 tests or 1 test or 3 tests. And in blood banks, what do we use? Only 1 test. Okay. What happens here? Anybody wants to explain? This you understood? This is also used in which cases? Huh? In antenatal cases and asymptomatic and person undergoing surgery. You do these tests for the surgery also, no? You're operating on the patient, you should know the serological status of the patient, right? Okay. So along with this, what are the tests you know about? First is immunochromatographic test, lateral flow assay. Okay, that we do. Second, flow through assay and ELISA. Okay. What can help you with the prognosis, knowing the prognosis of the patient? That is keeping the count of viral load in patient, which is done through real-time RT-PCR. Okay. In kids, we do DNA detection. Okay, through PCR. कुछ समझ आया थोड़ा बहुत? This was SGD. No? Let's revise again. Tell me the clinical stages. First was acute illness. Second, latency. Third, Generalized lymphadenopathy. Fourth, AIDS related complex. उसमें क्या हो सकता है? And diarrhea for more than 1 month. Okay. And then last, AIDS. And what is the worldwide organization looking after this? This is Indian. UNAIDS. Okay. It is known as UNAIDS. They target to eliminate AIDS before 2030. That's there. There are some other organizations which work state-wise also in collaboration with. You will study about antiretroviral drugs too. CXCR4 and CCR5. Mutation in these two coreceptors are seen in people, and these people have resistance to AIDS or unusual late development of the disease in them. So this is also a target for vaccine development. Okay. To develop a vaccine, you will have to be infected with the disease. There are no known treatments. You can only delay the death with, and so you will not find any volunteers, right? Human volunteers. And then you will need better animal models which are in analogy with the human immune complex, which is not there.